And, all right, we should be good to go.
Okay, good afternoon, everyone. It is 12:57 and I'd like to call the July 25th, July 2025 quarterly meeting to order for this committee. So bringing at the time to you.
Just start.
Okay, all right, Brendan, can you call roll?
Sure.
Thank you.
And those of you, if you are online, if you can make sure your camera is on so we can count you towards the quorum. Dr. Maravecchio?
Here.
Here, Mr. Bennett? Here. Mr. Billings? Mr. Bushki? Here. Ms. Sashery?
Here.
Ms. Crane?
Here.
Ms. Hayden is not here, but we have Mr. Bernard Brown here in her place. Ms. Hano?
Here.
Ms. Harmon? Ms. Kelly Aduli? Mr. Macaluso? Ms. Nguyen?
Hey, I'm here, but can you see my camera? Because I keep turning it off and on, and it's not showing on my end.
No, we don't see it, it's a black.
Yeah, I'm gonna keep messing with it, but I'm here.
Okay. Let's see. Mr. Rowe? Here. Mr. Williams? Ms. Shu? Perfect, and we do have a quorum.
Okay, thank you. And then Brendan, can you please read the virtual protocol?
Meeting rules, sure. Let's see, for committee members and members of the public that are attending in person, please raise your hand to speak and wait till you're recognized by Ms. Hano, who is chairing the committee today. Please keep your side conversations to a minimum and comments related to the topic that we're discussing. For those of you that are attending virtually, remember your camera must be on and you have your first and last name showing for you to be counted towards our quorum. Please keep your microphones, for those of you that are online, muted until you're called on by the chair, and electronically raise your hand to request. For our attendees, if you're on electronically, you can raise your hand to request to speak, and once the chair recognizes you, we will unmute your microphone, and then you'll be able to speak. And then after you make your comments, we'll mute your mic. The Q&A is available for those that requested an ADA accommodation to participate. Otherwise, we do not have the chat functioning. Public comment will not be accepted via the Q&A except for those individuals that did request an accommodation to do so. Otherwise, if you have public comment, you'll need to raise your hand and make that comment. As for order, for committee members in person and virtually, you will be allowed to speak first. And then for public comments, we'll take those here that are with us in person in the room, and then we'll take those that are on virtually. All comments from the public may be limited to 2 to 3 minutes. That is up to the chair's discretion and how we're doing on time. We also may limit the comments to once per person. And finally, before each vote, you'll have the opportunity to make public comment. And then we also have a designated public comment period at the end of the agenda. And so any comments outside of those times would be up to the chair's discretion.
Okay, thank you, Brendan. The first order of business is the approval of the April 25 meeting summary. Everyone should have reviewed the summary, which was attached in your agenda received via email. There's also a committee in the committee. There's also a copy in the committee package. I need a motion to adopt the April meeting summary.
So
Tori, can I get Tori's motion to adopt the April meeting summary? Is there a second?
I'll second.
Thank you, Brian. Is there any discussion? Public comment? Now we will do a roll call vote. Brendan, please take the roll.
Sure, so a yay is to accept the April 2025 meeting summary, nay would be not to accept it, and you can also abstain. Dr. Maravecchia,
Yay.
Mr. Bennett,
yay.
Mr. Billings, Mr. Blinsky,
Yay.
Ms. Shashery,
Yay.
Ms. Crane,
Yay.
okay, not here, Ms. Hano, oh, you're the chair, skip you now, Ms. Harmon, Ms. Kelly Aduli, Mr. Macaluso, Ms. Nguyen, you don't have your camera working, so we'll skip that one. Mr. Rocca, yay, Mr. Williams,
Yes.
and Ms. Shu. You have 8 yeas, 0 nays, so motion passes.
Okay, thank you, Brendan. Okay, so first up is our non-conjunctural activities. And so it's the human community-based services and for Julie Foster is Mr. Bernard Brown. So can you please give us some LDH updates?
Yeah, sure. So I think there was a couple of specific topics that the committee wanted to hear about. So I'll kind of start off with one of those, which was House Bill 559, also known as the LGE bill. During session, there was a lot of conversation about this legislation in terms of the impact it would have on LGEs. The bill that was signed by the governor basically just required some additional reporting from the LGEs and for the LGEs to work with LPH to develop that standard reporting. I can say now that the plan is to meet with the LGEs to discuss what that will look like. As far as right now, there is no substantial or significant impact to the LGEs in terms of that bill. I know we got a couple other folks from the LGEs here, but if you have any additional things to add to that, but just in general, it shouldn't have a major impact to how they operate with respect to PD services. So the other thing, and I'll take this one too. I know you guys remember last year during the legislative session, there was a resolution that required a rate study to be done for HCBS, which is the Home and Community-Based Waiver Services, as well as for the ICFs. Both of those studies are set to wrap up in August, and the actual reports to be published thereafter. As far as updates beyond that, not much there. I do think for the home and community-based one, there was those work groups, those technical work groups that Milliman put together. That's running the home and community-based rate study. They're going to get with those technical work groups and have share the findings with them. And then after we do all that, we'll publish the report. And I believe it should include what the recommended rate should be based on whatever methodology we put in and some of the rationale behind how they got to that rate. And I think that happened on both sides. There's some additional stuff with the ICF one that after the report is published, there's some additional work that'll take place. But again, like I said, that isn't set to come out till I think the end of August. So there'll be more detail, I guess, at the next quarter's meeting. And then I guess I'll turn it over. Oh, budget, that was another question, sorry. So from OCD's perspective, budget impacts. Right now, we don't see any major budget impacts. There are two things I do want to point out though. One is that there was language submitted in HB1, two pieces of language. One was around the nursing consult rate. There was money that was actually put into the budget that's coming from the Developmental Disabilities Trust Fund to cover the funding for the first year for that nursing consult rate. So most of y'all are probably like, what's the nursing consult rate, right? With waiver services, there are needs that sometimes in terms of assessments and or other consults where a nurse or RN level nurse is required. Specifically, like if there are delegatable tasks, each provider agency has to have a nurse available per license and administrative guidelines to assist or sign off so that DSW can perform some of those delegatable tasks, right? And what the providers were saying was that those responsibilities weren't necessarily covered in the rate, or there were additional responsibilities to assure health and safety that we were asking the nurses to do that wasn't necessarily compensated. So what they went and advocated for was additional funding to cover an annual budget just for nursing consult. And that money was funded. So the next steps with that, from a department standpoint, is that we need to submit that to CMS because that's a new service. So we're gonna have to submit that to CMS for approval. So we're looking at hopefully January 1, and Brian, correct me if I'm wrong, if we can get everything in time, we're looking at a January 1 start date for that service. Okay. The other thing that I touched on was it was in HB1 as well. There was some funding put in there to cover support coordination agencies for the work that they do assisting families when they're linked to the waiver. For the folks who got a waiver on the phone there in the committee room, that process, once you pick your support coordination agency and they assist you with completing the Medicaid application, they assist you with any questions you have around the 90L, they're currently not being paid for that work because we cannot bill Medicaid until you are certified to receive Medicaid services, right? So what they went and advocated for and received funding for was the money to cover those months of pre-work while you're linked until you're certified. So that's in there as well. There's some policy things that we need to iron out relative to how we implement that. But the target date is sometime in 2026, early 2026. And I think that's all the updates I probably will accept, but I'll turn it over to Gary and Brian and see if they have anything extra to add.
For budget, I have one additional thing. So by and large, from this past legislative session, Medicaid's budget was a fairly standstill budget. We didn't have any major cuts to services or programs. Medicaid, like most state agencies, we did identify some efficiencies. So if you did see any cuts to our budget, that's likely where it was. Throughout the past year, the department worked to really look at our operations to see where we could become more efficient, looking at the contracts that we have. So here and there, we were able to identify some areas where we could combine things or just general efficiencies that we identified. So that resulted in some minor reductions, but those were all on the administrative side. None of those were affected programs or services. But one additional thing, in addition to what Bernard said in HB1, which is the big budget bill that came out, and this wasn't tied to any specific legislation, but it was included in the budget bill. There was about $9.3 million that was budgeted for special needs pediatric dentistry. And I know that that's been a problem area, especially with our population. Sometimes it's hard to find dentists in certain areas of the state that can provide services. So what this money is going to be earmarked for is to focus on enhancing rates for that population so that we can hopefully attract more dentists to serve the Medicaid pediatric population. We haven't started filing anything with CMS yet to change the rates. We're still kind of figuring out which services in particular we want to target. But and specifically what populations, but I think we're going to target the individuals with intellectual and developmental disabilities, because that subset of the overall child population, they have more difficulty, I think, finding providers or dental providers. So that $9.3 million, that's what that's going to be targeted for. As far as the state budget, that's all that I had.
Okay, next for the Office of Aging and Adult Services. One item is the budget or impact update from OAS. Like Bernard mentioned for OCD, a lot that were adversely impact. Actually, we had an increase, somewhat standstill because we had an increase related to some of the personal services, salaries related benefits. But we also had an increase in IAT reduction in state general fund, kind of like Brian mentioned. Some of the services and program services that our staff handle that are related to Medicaid functions, those salaries now, a portion of those salaries now will be paid from federal funding. So our interagency transfer portion of the budget did increase by virtue of that decrease in the general fund, no longer in state general fund, for a portion of those salaries. We also had an increase in our statutory dedications because the Nursing Home Resident Trust Fund did increase. In addition, we did get in this last one cycle 8 additional additional positions. 3 of those will be associated with our Adult Protective Services program, and the other 5 are within our program operations, which are dedicated to assistance with our participants on the Community Choices waiver. So that reduction in state general fund and increase IAT is related to what Brian mentioned. Those were efficiencies that we were able to find and tie those hours and a portion of the salaries for those staff that work on Medicaid type programs. We were able to pay that out of federal funding versus state general fund. And as far as any plans being put in place for potential reductions, it's really early for us to tell at this point. Of course, we're always looking for efficiencies. One of the main things I can say right now is that we will be looking to do some of the same work and due diligence we did last year as it relates to, are there any other program functions that staff are working on where salaries or a portion of salaries can be tied to a Medicaid, Medicare function where we can use IET or federal funding to pay staff salaries or a portion of their salaries versus state general fund to find savings in that matter. But as far as any other reduction that is going to be, it's really early to say that we will have any cuts that would impact our participants.
So I just want to add just one more thing, I'm sorry.
Okay.
Going back to 559 as that LGE bill, Julie asked me to ask you all, if there's something that you would like to see are improved or done differently with the LGEs, if there's some efficiencies that you believe are there and available, please shoot us an email if you don't want to talk about it openly. So when we do have those discussions with the LGEs, we can, if there's opportunity to raise those things so we can maybe improve how they interact with the community, that'll be helpful. So again, if you have anything you can think of, it's like, I wish the LGEs did this, or I wish the LGEs can do more of this. I don't want to make it sound like they're not doing it, right? But if there's things that you want to highlight and make sure it's standard across all the regions, each LGE may have a little nuance, or little things they do differently. But if you like it, you want to highlight it and say, all the LGEs I think should do this. Please let us know. Talk to your friends and your colleagues that and let them know like they have ideas, shoot those to us, because it's the opportunity for us to kind of explore and examine those things. See if there's things we can put in place long term. Okay, so that's the plug.
Okay, thank y'all. All right, so, yeah, we're gonna go with the contract.
Oh, I was just gonna do some follow-up.
Oh, I'm
So,
sorry, Brendan.
Since Bernard had put it out there, I don't know if anyone on the committee has ideas that they wanted to share, or if there's anyone online that maybe has some comments about things. I know our Act 378 committee meets after this, and they may have some ideas as well, but I wanted to give you all an opportunity, or those online an opportunity as well, if they did have any feedback that they wanted to share.
I do have a question. Can you give us like a gist of what House Bill 559 is? Like 2 sentences.
Sure. It requires additional data, right, reports, activities, and standard outcomes for all the LGEs. So they're gonna now be required to not only just have that for all the LGEs, but I think it also says they have to report that to the legislature.
Okay,
So it's kind of things we have in place already, but I think they're telling us to go back and see if we can standardize some things and then report that out to them. Does that help?
yes.
Go ahead.
And I will say at our last meeting, we talked more about it because the initial version of the bill is much different than how it ended.
Right.
It looked at essentially removing any sort of local control from the LGEs, and so it had created a lot of conversation, and that stuff is not in the bill anymore.
So are the executive, because I thought that is brand new. I thought it was that essentially, in my mind, it was instead of the board making decisions, the Department of Health would make the decisions specifically as to who the executive. So did that part go away?
Yes.
Yeah, that was amended out, yeah.
But I don't like any type of dictatorship. All right.
Jill, I have something. I don't know if the other committee members had anything, but Bernard, I do want to mention this because this has come up in conversations that I've had. So with the IFS dollars, there are, I feel like some regions that approve things, some regions that don't. And I know the council had a work group where we revamped the manual for IFS dollars. I just still feel like some of the human service districts or authorities, they pushed this even when I was doing support coordination, that they are the payer of last resort. And so when we revamped the manual, we took all of that language out of there. I just think it's still really embedded in the minds of the people that review the applications and that give those approvals. So that's something that I would like to see change. Like if the people that are reviewing the applications, if they can get more training on, I don't have to give you this. I tried 5 different places before I came to IFS or the Human Service District or Authority for this particular need for this family or this individual developmental disabilities. I just think that is still embedded in the Human Service Districts and Authorities. That's something that I would like to see change. Just consistency across the board where the districts are not telling families that they are the payer of last resort, because I just think that that's still going on. I've had conversations with families and I'm like, well, they shouldn't tell you that it's still happening. So I just kind of wanted to bring that up. That's one of the things that I would like to see change. I don't know.
Awareness of the fund too, I think, is because I run into a lot of family members, moms especially, that don't even realize that that's an option. Even though it's an option of last resort, even though it shouldn't be, they don't even realize it's an option at all. So I don't know how to spread awareness. Her support coordinator, I'm not sure who she's with, never mentioned it to her. She didn't know that it was an option. So I think lack of awareness is an issue.
Okay, any more questions, comments, concerns? Okay, there you go. Okay, so from Jason, I have some questions.
Sure.
So, right, yeah, Brian, Gary is OCTD, sorry. Which one is the most correct? It was gonna be more separate. So do I just go back? Do I just go to contract?
Yeah, if there are no more questions for the
Okay.
agency, then
So, no more questions. Okay, any online? Okay. So, we're moving on from our status report in the package. Hannah, would you like to start us off?
I would love to.
Great.
So with Partners in Policymaking, you'll see in the status report, I already kind of gave a little brief of how the last 3 sessions went. There were 18 participants that graduated. It was great, everyone spoke and all that fun stuff. But something that's not in the packet is going to be that the Partners in Policymaking reunion is coming up. I don't know if this is the first one.
Yeah. That this particular staff have done.
To my knowledge,
Yes.
as far as concerns, the first partners reunion we've had. So Rebecca's doing really well planning that. We had at least 70 RSVPs for it. Last time I spoke with her. So that's gonna be coming up August 29th through 30th. We have some guest speakers coming in. Al, that always comes and speaks at Partners. And Patrick Schwartz, or what's his name right? He came and did the education portion as our guest speaker this year. He was a new speaker, but he did really well. He was really well liked. They received him well, so he's gonna be coming to the reunion as well. So that is Partners. Any questions? Concerns? Ed, take one. Okay. I also have YLF, Louisiana Youth Leadership Forum. You can see the little update, but since this report was done, we actually had YLF. That was a few weeks ago. This year we went to LSUE in Eunice instead of ULL. It went really well. Elaine was there, she could talk more about it if you had questions. But it went really well. There was 13 delegates. They were all high energy, really receptive. Lots of great potential leaders in that group. We also had a representative from the Texas LADDC, Texas LADDC, that doesn't make sense. The Texas DDC. She came and she wanted to just experience how we do ILF because they want to get that program started in Texas and they heard good things about us. So she came and she was part of the whole thing. So that was exciting. We also, just a couple of things I didn't mention there, but I thought were good piece of information because it is a new program. We do have 4 of the alumni from the last 2 years came and staffed this year, which is exciting to see them go from. Yes, a lot, that's a lot. So many more. So it was nice to see them go from being delegates 1 year to the next year wanting to participate as a staff member, not just came and then disappeared. So they did really well. It was even cool seeing them able to participate with the other people and from a different angle. We also have 3 of them have gone on to join Partners in Policy Making. So that's an exciting thing to see them moving to the next level of advocacy. And one of them, which you all know them, but we also have one is now a council member. So I think YLF has done really well in showing how we can bring in these younger people and get them into the advocacy world at a younger age, so they're able to do more with it. So that is it for YLF. Any questions? Just what I like to hear. And one thing that's not on your agenda, but is a change, is we have our new website is in the works. What it says in the status report is that the website will be launching sometime like right now, but it'll probably be more like the end of August that we'll launch the new website. It's just taking a little longer to process everything and check everything, and I'm not gonna lie, I don't know all the website lingo, but they give a lot of information on what they're doing for the next few weeks that I'm not able to share with y'all because you might not know what it means either. But bottom line, website's getting launched at the end of the month. We'll send out an LADDC news and blast all over social media. It's gonna be a lot more accessible, a lot more user-friendly, easy to find out what we're doing, what we got going on. And it should be really cool. So no questions, I'm assuming.
So, any questions? Okay, baby, you had enough? Okay, any questions before we move on? Sorry, that's all this first. Okay. So now, Stephanie, would you like to share about your initiative on sex abuse and neglect?
I know it's small on here, but when I zoom in on the screen, like you can't see the whole picture. But it is in your packets. It's this long legal sheet. I don't know why it printed on a legal sheet, but I just rolled with it. So the council has contracted with Team Dynamics, and they partnered with OCED for this initiative. So far, they have done 6 trainings across the state. They actually did a 7th one, which was on July 15th, but I haven't gotten information on that because they submitted this information before that training. So the status report says that there's 3 additional trainings. There's actually 2 that are coming up in August. We have sent out multiple, I want to say at least this quarter, we sent out 2 LADDC news that were, for registering for these trainings. And then there will be one coming out within the next probably week or so that has both of the August ones listed, so that you could register for those. This initiative was what I'm trying to say, was added, or was continued, was continued for the FFY 2026 action plan with Team Dynamics. So we are going to be working with them on the same initiative. So far, the numbers that I have for the 6 trainings that I have the data on, they've trained 42 people across the state, and I still have the data on the July and then the 2 in August. I did attend the one that was in Baton Rouge. It was a good training. I learned a lot. I don't have the documents though, they're in my car somewhere. I don't remember what I did. But it was a good training. There was a little video we watched and it was interactive. There was like a Q&A. So if you have any questions about this one, please let me know. All I have for that, yeah.
Stephanie, the column that says professional, are those providers?
Anyone that has said that they were a professional is included, so it could be.
Just anyone working in
Yeah, so it could be. I will say that the one that I went to Baton Rouge, they were on their lunch break, I remember, because they were like, we came, we're doing this, and then we're going back, because they did get on a CEU for it. So Team Dynamics has whatever certifications to give the CEU, so.
A lot of their other trainings, we tend to get a lot of providers, work coordinators, get a lot of social workers, a lot of hospital social workers.
Yeah. It might have been hospital workers.
Yeah.
I don't remember, but I do remember that they were like direct workers with people with disabilities, what they were in that profession. I don't know if they collect that information besides, because on the questions that they ask, it only asks self-advocate, family, or professional. Is there any other questions? Hopefully I can answer. Yes.
You're right, just my question is, it looks the attendance looks only a few people, so I just wondered who know this change, I mean, how to like broadcast it.
Yeah, so we send them out in LADBC News. So I send it like kind of by the month, whatever ones are happening that month. I sent one at the very beginning when they had everything scheduled that said like, here's everything that's scheduled. You can sign up for it. But I've been I don't want to send so much like every week of the same thing because then people aren't going to read it. So I've been trying to take them and put them all into one for the month. So like May, I sent one out. June, I sent one out. I sent one in July, and I'll send one in August, or at the beginning of August to advertise those. And then they also, Team Dynamics, they have their own mailing list. So they send it through their mailing list. We also put it on social media, so we have our Facebook page, so we do advertise on there. And then they work with like any person that they collaborate with, so like FHS centers or sometimes LaCan, like when they do their nails, and then sometimes the ARC, because they do a lot of the same work and they partner with each other for different things. They'll send those out also, but that is up to the contractor to do those outside collaborations for that. So it's like we can send it out also, and we do. So anytime they send us information, we're sending it out for them also.
What is training, is it in person?
Yes, they are all in person. As far as I know, there isn't an option for online. if that is something that I think more people are interested in, and I can talk to the contractor, that it could be something that we look into for the next, like this upcoming year, since it is on the plan for that year. They like to do more in person just because it's very interactive. They do a lot of talking, a lot of scenarios and things like that. So I think they prefer it to be in person, just so they're getting more response and interaction from people there.
Okay, thank you, Stephanie. Are any more questions? Okay, no more questions. All right, thank you. The next, all right, next up, Brendan will give us all of these other remaining activities. So Brendan, you have the floor.
Great, thank you. I think a lot of what I have to share is mostly in your status reports. I'll try to hit a few things. But as far as the CAN goes, we were successful in our advocacy efforts this year. We had 3 items on our advocacy list, which was no cuts to any sort of services for people with disabilities. And we wanted to make sure that we restored funding for our Families Help and Family Centers, which was $500,000. And then improving those seclusion and restraint policies in Louisiana. So we were successful in all of those. I know our agency folks here kind of shared a little bit about their budget, so I won't go into all of that. But I do know, in addition to funding, there was a cut for People First funding, and I know there was a lot of advocacy around that. They were able to get a restoration in those dollars as well. I think there were 750 new community choices waiver slots, I believe it was. That was added to the budget, so that's really helpful because I know that program has quite a bit of a waiting list. There was also, I think, $4 billion that was added to youth and rehabilitation services. And so there was some advocacy done around that by the ARC, and I know some of the FHF centers advocated for that as well, along with many other people. So I'm pretty sure probably Melissa will talk more about that whenever she discusses any sort of updates in the education committee, because they are on the education employment committee. But those are some of the wins in the budget there. But for the most part, no cuts to services that we have to worry about at the moment, which was great. All of the dollars that we needed for FHF were also restored. Half of it, so 250 was in HB1, the other 250 was in a supplemental legislation or supplemental budget. But those dollars make it essentially a standstill budget for the FHF centers, which is a little over $1 million that we split between the 9 centers that we contract with. And then the restraint and seclusion legislation, that is Act 479. We worked with the ARC, and I see Kelly here. We worked with Disability Rights, which is here, DOE, or Department of Education, worked with Bessie, worked with charter schools. There's a lot of work that went into that legislation. I think we're all very proud of it. And that is going to be discussed more in the Education and Employment Committee, so I'm not going to talk about it in here. That committee happens at the end of the day, so tune into that if you want to hear more about that. But we also pushed some information about it as well when the session was over. That kind of gave you a recap of that particular legislation. We did see some increases as far as participation. So we saw about a 7% increase in the amount of people that were participating in advocacy through LCAN this year. I know it doesn't sound like a big number, but since COVID, we're really seeing like this dwindling of participation over the years. And so this year we saw people come back, which is nice. It's a testament probably to picking an agenda that really resonated with folks. We also saw almost a 20% increase in people that participated in our action alerts and yellow shirt days. Certainly when you were monitoring things like, something as broad as disability services, you get a lot more people involved. And so I think that had some of that, can be attributed to that, but in general, I think folks were just really engaged in advocacy this year, which was awesome to see. I don't have a percentage because it was not, a great percentage, but there was more participation from council members, in advocacy this year, which we appreciate. There's certainly lots of room for growth, and I would encourage all of our parent and self-advocate members to really stand behind your agenda that you vote on every year, really get out there and participate. I mean, things as simple as action alerts, as sending an email. We really don't have a great success rate in council members participating in that. So this is me encouraging you to participate in those particular activities. If you can't make it out to the Capitol, can't make it to Yellow Shirt Days, if for some reason you can't go to your roundtables, at least try to participate in those action alerts. Because you're creating agendas that you're asking people to advocate for, and we need you to advocate as well alongside with them. We had debriefing in June. We talk about debriefing every year. It's just a way that we get together with CAN, our FHS centers. And we kind of talk about, right, what did we do? How did we do in our action alerts and our Yellow Shirt Days? What advocacy activities we did? How did we perform? What worked? What didn't work? What language did we use that we need to change? Pretty much anything and everything that relates to advocacy over that past year. And so one of the things that we decided this year to give a try is to not have our legislative kickoff. So kickoff is something we usually talk to you about in October, because that's when you develop your advocacy agenda. And so we would have legislative kickoff usually around September. And so right now, all of our LACAN leaders in their regions, they are hosting, and a lot of them in partnership with FHF, are hosting community input meetings. This is where we ask members in the community to give us ideas of what we're going to advocate for next session. So even though this session just ended, we're already preparing for the next. And what we would do at kickoff is our CAN leaders, our FHF directors would come and review all of that community input, and then kind of come up with a recommendation that they would send to you in October for you to consider to add to your agenda. This year, we're taking out that kickoff piece, because what we did last year was we added in a legislative ad hoc committee. So what we found was whenever you're debating what to put on your agenda in October, it pretty much overtakes your entire business meeting. We have to cut agency report short, we have to cut committee report short, a lot of the business you need to do. We have to cut short because you spend so much time discussing this advocacy agenda, so we create this ad hoc committee. And that is going to be the committee that's going to essentially come up with those recommendations for you. So if they're coming up with the recommendations, it doesn't make sense that we utilize your dollars on contracts to have one set of recommendations, then to bring you all in to have another set of recommendations that may or may not match, and then go to the council for the final approval. So we're trying to streamline things. We have encouraged our leaders and our FHF directors to participate in that legislative ad hoc as members of the public, but we're also someone on that committee that is not necessarily a council member. So we're going to have a representative of FHF that is going to sit on that committee. We're going to have a representative from one of our CAN leaders sit on the committee as well to help with some of those conversations, with some of those decisions that you're going to have to make. And I think probably tomorrow it'll be out there, but we are going to be looking for folks that would want to participate on that legislative ad hoc committee. That committee is probably going to meet, certainly not before late September, but probably more so in early October, because right now we're doing community input meetings. If you were signed up to receive our information, you should have gotten an info alert maybe last week, I think, that went out that basically said, hey, these are the community input meetings that are going to be happening in your region. This is your chance to come out. A lot of them are happening virtually. Some of them are happening in person or doing it as hybrid. So once those are over, those happen through the end of August, then we'll be able to look at getting that legislative ad hoc committee going. The community input meetings, if you did not get the information, there's gonna be at least 2 in each region. If you did not get that information, if you go to our website, ladc.org/LACAN, that's LACAN, you'll see where it talks about our regional membership meetings there, and you'll be able to get the schedule for those community input meetings. We also sent out some information. We had a rebranding of LACAN. We are still the yellow shirts. That was a big question folks always had. The yellow is still there, whether you like yellow or not. I know that's debatable when you wear those shirts about it. It looks good on you or not. But those yellow shirts are still there. Our shirts have been more simplified. It's just going to be our new LACAN logo on the front. As you know, our previous shirts, we had messaging on the front and back, and the LACAN logo was very small. And people know us as the yellow shirts, but they don't necessarily tie it to LACAN or the council. And so the shirts are really going to be streamlined. We didn't want to do any sort of messaging outside of just our logo. Because, you know, messaging can change, right? We don't want to be locked into particular statements or messaging that may not apply to something we're advocating for at the time or in the future. So right now we have to replace all of our materials. So I did not bring you a goodie bag of fun things for you to have because we're kind of saving those for whenever our leaders go out and outreaches. Yellow shirts, if you do come out to Yellow Shirt Day, you will get a new yellow shirt. And so as we reveal those supplies, we'll be able to share that with you guys.
No
That's-
goodie bag.
No goodie bag. That is it for LACAN. Any questions specifically about LACAN before I move on? Great, okay, families, helping families. You have a report in your packet. That is fourth quarter data. And before anyone calls to tell me that that's not correct, or any of you tell me it's not correct, that is not final data. Say it again before anyone calls me and tells me it's not correct. That is not final data. What you have here is pretty much most of the information. We have to create our documents before we get all of the information in, so this is not gonna be the final. You'll get that in October. Already talked about, we were able to get that, those not increased dollars, but we were able to get the restoration of funding. So their contract is going to look the same. Since we do not have an increase in funding, we are not increasing deliverables for next year. One of the things you'll notice in the contract, not in the contract, sorry, in your packet, the document that you have in your packet, you'll see 2 numbers under the targets. You'll see, for instance, under the referral, it'll say 2850, and then you'll see 1900 GNO. That is just because we started our contract with FHF of Greater New Orleans after that July date that we started with the rest of the centers. So starting this July 1, the contracts with our centers, they're all going to be looking to achieve those same deliverables. You won't see that differentiation, but that's why you see maybe different targeted deliverables for one center and the rest have a different set of they have to meet. Last year in the number of info and referrals that are being put out there, which is great. That means more people are reaching out, trying to get connected with different services and supports in their area. Our number of trainings increased across the centers, and the peer-to-peer support also increased. And so those are 3 of the big things that our centers do on the daily, is info referral, trainings, and peer-to-peer support. So we saw increases in that area, and we'll be able to give you specifically how much of an increase in October once we finalize that data. We're also going to have monitoring and desk audits that are going to come up for our centers between now and October. Usually every year we try to collect information from our centers. We'll do an actual monitoring visit. We go into the center, we talk with staff, we interview. Sometimes we talk to board members if they're available, but we speak with the director, we speak with staff members. We do knowledge checks, we look at financials, things like that. Again, it's come up in this committee before, we are not accountants, so we are looking at very high level, financial stuff and not super minor things. But those will be happening between now and October, and you'll get more information about that as, we move on next quarter. So any questions, families helping families wise? Jim?
I'm trying to highlight, and I forgot what you said. We saw increases in referrals.
Yep, information and referrals, the number of trainings.
Brendan, there's like 5 things that say training.
Yeah, it's a collective of all the training.
Okay,
And then peer-to-peer support.
okay. Thank you.
Well,
Any questions about FHF? Thank you, Brendan.
we have 2 more to go, hold on.
Okay,
So our next initiative, is the co-occurring disorders. That is activity, 2.1.3. So we collaborated with Arc Louisiana on that one. They conduct statewide trainings, for people with disabilities and their families, to really help educate folks about the different services and supports that are available for people that have a developmental disability, but also a behavioral health need. So there is a report in your, packet, I believe, and it shows that we've had 7 trainings, so far. There was one, I think, that happened earlier this month that I don't have information for right at the moment. So that'll be reported out in the next, quarter, that you'll see that. And 33 professionals participate there. And then our other activity would be our FASA training and awareness, that's 2.2.2 and 2.2.3. We collaborated with LSU HDC, or Human Development Center, on that one. And it kind of goes hand in hand with one of their priorities this year, which was to bring awareness to fetal alcohol spectrum disorder. And so in addition to their awareness campaign, they're also doing trainings that are being offered to social workers within the Department of Children and Family Services, as well as foster parents. This training, it kind of got off to a late start. I think we talked about it at the last meeting. DCFS had put a kind of a halt on doing their trainings. They were doing some reorganization, some restructuring about their training process, and so they weren't participating in any outside trainings at that time. But that has since changed. They are now participating in the training. So far there's been 16 trainings. There's been over 230 people that are participated in those trainings. And so they're also working on a plan to, I think, create posters. And there's also an online that they're going to try to send out statewide. And hopefully we'll have more information about that at the next meeting, because I don't have a lot of information on that initiative at the moment. So any questions on those?
well, if there are no questions, thank you, Brendan. All right. Okay. So I'm gonna move on to announcements. Please note that our at 3:78 committee meeting is held in this room at 2:45, followed by education in employment committee meeting. Also, tomorrow is the full council meeting, which starts at 10 a.m. in this room. Those that have registered to participate virtually should have the link in your email. does anyone on the committee have any other announcements to make? Okay, anything public? Nope. Okay, so I hereby adjourn this meeting at 1:57 p.m. Thank y'all.
Okay.
I know.
You're a close friend.